Hi everybody, this is Ray, this is Life and Vibe, and today we're taking a little bit of a stroll in Virginia Beach, Virginia, so welcome. I hope everybody is also having an opportunity to get a little bit of cardiovascular exercise in today. And I wanted to approach my content a little bit differently today because I've definitely been getting a little bit heated with some of the content creators and influencers who would love to actually be, probably would love to be licensed medical professionals, but in reality they aren't. And so instead they are creating content about health and wellness. And I mean, I want to think these folks are well-meaning at all times, but obviously it does concern me when somebody is giving health and wellness advice and they aren't licensed. And it just seems to be getting very fashionable to have someone without actual medical licensure giving health and wellness advice. And I can understand a mistrust for those in the medical field. There's certainly a lot of stories that make people not trust people. So I'm hoping a little bit with this channel, with this content, that you'll start to consider maybe trusting and looking to your medical providers to be able to help you with your aging journey, with your preventative journey, and with helping give you good advice. And so that's really the sort of stuff that I really do encourage. And I probably going to be pulled around a little bit around here because I have my dog walking with me because I'm a massive multitasker. So anyway, if you like this type of content, please hit the like. Please hit the subscribe. I would love for somebody to give me a comment. I'm really trying to get out content every day at the moment, just to kind of push my content of the YouTube algorithm. I will still try to do reaction content. It just takes me so much longer to film that content and to edit it and to upload it into the computer. So I do apologize if I have tried to change the content recently. I just want to be able to put content out so that I can keep touching base with folk. And I want to keep getting this message out because even though these people might not be an MLM scammer in the health and wellness field, or somebody with, they are still people with large platforms who I saw one video today, and like I said, I don't like to dox people. Unless I'm sort of sitting down and actually doing a reaction to the content. But I was just as shocked at like the number of subscribers this person had. The whole entire content is about health and wellness. This person is a journalist, not a provider, and there are people asking her in her comment section about, you know, what they should do about hormone treatments. And I think it's just, I just think it's really like deceptive of people to, sorry, like I said, I have a dog with me because I got to multitask. Deceptive to give health advice and not actually be a practitioner, because I just always question what they're promoting, you know, and it may be something that works for them, but are you considering a lot of other factors? And that's kind of, you know, and there's a lot of like aspiration I see in this content too. And I think that's what kind of also brings people to it. But it would be very expensive probably to follow this person's overall health advice. When I looked, it looked really expensive. Some of the things I do would probably be fairly privileged because I have employer health insurance. And so if you're somebody who finds yourself around my age group, which is mid-50s, I shouldn't say that, early 50s, let's say early 50s, so early 50s, and is still working, or maybe you are retired, or maybe you're, you know, having other reasons, you know, whatever, you know, I don't ever want to, you know, but probably a lot of things I will be talking about refer to being able to have employer health insurance and being able to do these things with employer health insurance. And some of the Social Security insurances too. This information would be applicable for you as well, because some of these things would be covered possibly in the Medicare and Medicare. Hold on, my arm was getting tight on that side. Oh Lord, Medicare Advantage plans. We're gonna get really fit in the arms with this going on. I'll tell you that much. My arms will be super fit by the end of this. Having to hold this camera out. Well, that's another thing is bone health, but that's another story. So anyway, all right, thank you. Let's not do that. You just had a bath yesterday. Oh, okay. So happy July. We're at the 3rd of July. And like I said, I'm still kind of trying to hopefully put this content out because I would like to be somebody who is an actual provider who is being able to give out this type of content and telling you what I would recommend as far as what would be recommended by the U.S. Preventative Services Task Force, the National Institutes of Health, the American Nursing Association, the American College of Cardiology, the American Heart Association. So any of these types of groups, if you really feel that that is something that you find important to think that background and knowing it's evidence-based and it's based on medical science and evidence-based practice, then this is your content. Like I said, I am not ever going to be promoting essential oil in food. The only time I would think essential oils would be good is maybe in a candle, maybe in a little diffuser on occasion. With pets, their requirements taken into consideration. So anyway, okay, I'm off again. So I'm trying to kind of set this up because I would like to be able to get, people to want to get to know me. So, and want to be able to follow their health journey along with my health journey and do it, a way that isn't going to cost you a lot of money, hopefully at the end of the day, and will be actually effective based on medical science. So, long story short, what are we doing this week for my health? So I've got a couple of things planned in July as far as trying to get ready for my own personal health journey. So there's a couple of things on the books, as they say. So I do believe that good self-care is always really important and that you should follow up with a lot of different types of providers, especially as we get into our, 40s, 50s. And some of us really need to really start seeing our first preventative, just regular doctor in our 30s. In your 40s, you should definitely be having added your optician into the mix. And there are a lot of preventative screenings like colon cancer, breast cancer for ladies that should be started right at 40 years old. So waiting until your first cardiac event to actually have a doctor is probably really not good medicine. And I see that a lot. So I always say, don't delay getting a provider. I know it takes a long time to get an appointment. I know these appointments are really difficult to get. I understand. I have to wait a long time. I'm trying to see a dermatologist. I'm going to see if my dermatologist I had from before, I know he was in the same healthcare system that I currently work for, so I'm switching arms again. He is in that healthcare system. If he's still, practicing actively in this area. So we'll find out. So I got a call from a dermatology office because I need to see a dermatologist for some things that I'm concerned about, and just I need to get followed up because obviously I live in a sunny place. I do like to go to the beach, and so I do always recommend that it's good to have somebody who is doing a good screening on your skin at least once a year, and if you're really bad like me, at least every 2 years. At least, if you see something suspicious, immediately make an appointment. So especially since we use tanning beds, and tanning beds are no safer than being out in the sun. It's the same idea. It's actually probably worse because it's super concentrated. And I think people like use tanning accelerators, and I don't think people necessarily put sunscreen on when they go into the tanning salon. I don't really use those tanning beds. That has always been a big no for me, especially if you want to keep your skin looking young as you get older. There's only but so much Botox and fillers can do, and lasers. Well, you better have a lot of money to correct it, because these procedures, because you can get most things corrected. You know, you can reverse a lot of bad skincare that you've committed over the years. That is not difficult to do, but it will cost you a lot of money. My friends and I, we have this conversation about, skincare regimens and, what are the most effective procedures to undergo in order to keep your skin looking really good and young. So obviously, we are a fan of Botox. We have them. I used to lose a little bit in my lips, use a little bit in my face, but I haven't really been, that drawn to it. I haven't really noticed the difference, maybe because I don't get a heck of a lot of it at a time. So I've used it, like I said, primarily in the lips. Just to keep a little bit of the, especially, the lines that can happen above. My grandmother and my mother had, my grandmother and my mother had that, and neither were really, my mother never smoked, and my grandma maybe had a few cigarettes back in the day. So I always look at what my grandmother, especially maternal side, looked like, because that's probably going to give me a good idea of how I'm going to be aging. Also getting a DNA test. You can always do that. I got a 23andMe. Anyway, that's a different story. So that's one thing, is, doing all those types of screening. So what am I doing just this week alone? Let's just talk about this week alone, and we'll catch up along the week, because otherwise this video is going to get really long. I can see that already. And I can see this is still about to come, because that's very classic here in Virginia Beach, that if we get really hot weather like we have had in the last couple of days, we will get just a tremendous thunderstorm. So I'm actually kind of glad that I'm home early today. So you're probably not going to see a get ready with me in the morning video, because my mornings, I'm generally getting ready to go to work in the morning. I did go to work today. I worked like 4 hours at the cardiac rehab. I'm a cardiac rehabilitation nurse. And I worked about up until noon, a little bit after noon, and then I left and came home, ran an errand up in town, and then I came. Oh, I can feel a speck of paint. So we better get moving. It looks beautiful over here. I can feel a speck of paint. Look how pretty this is. Look at that. Can you see? I don't know if you can see. Let me try to. It's got like. It's because I'm blocking it. I think I am, but is this like water? This water, I don't know if you can see the water. Probably not. I don't have a good angle. There we go. That water leads up to the Lynn Haven, the Virginia Beach Marine Science Museum. And there's like all these like little streams. That's why I'm crossing over this bridge here. It's real pretty. So we're getting, again, I like to get out and give my dog a nice little walk down here. Specky of rain. I was hoping we could just go down and look at this neighborhood. Oh my goodness, I wanted to buy a house here over here, and I was not able to. Oh, my dog's just like, she is like something else. That's Junebug down there. There you go. If you hear panting in the background, that's what you hear. So this is a street that I actually wanted to buy a house on a long time ago. I just, at the time, I had the condo, but I didn't really have the down deposit for that. So anyway, I always find it's really important how I save and spend my money. So it's back to what am I doing this week for my own self-care. I'm just walking and talking about my health. As a medical provider, kind of let you guys get to know me a little bit. So what am I doing today on this day? So yeah. So it's getting dark. You may hear a rumble in the background. That is because sounds like we're about to get a storm. So we're gonna really walk a little bit quicker over here. Obviously, I'm exercising, and I'm gonna go home. I've got a paper to write for my schooling, and then hopefully I'm gonna get to go to bed in a good hour, and I'm off all day tomorrow. So I'll be able to catch up with you guys and just say, hey, I have a paper to work on, so there's no beach day for me tomorrow. So it'll probably be the paddling pool down on the patio, because that's usually where I get to be able to do my work and be able to be home too. So what am I doing this week? Because every week I do something towards my health that's kind of a preventative and a maintenance type of service. So this week, like I said, I'm going to be off tomorrow, Tuesday, but I am working on my graduate degree. And what does that get me in the future? Well, obviously, an ability to prescribe medications. It gives me more experience, more licensure, an ability to work more in the specialty that I love in medicine, and be able to have really good expertise for my patients. So that's kind of part of the reason why I really am looking to that. Also, it's going to give me good longevity in my career, and learning and kind of working forward in your career is always very much encouraged in the healthcare profession. So that's what I'm doing. I'm also trying to work on some additional certifications as well. So that kind of covers Tuesday. That really does cover a really good part of my mental health, in the respect of like just my brain health, and being able to use my cognition. Because obviously one of the important things, you probably hear rumbling in the background, that's a storm coming. They get wild in Virginia Beach. And one of the things that's important is obviously making sure that we keep mentally sharp through obviously using our brains and exercising like I am now. And I keep my exercise fairly light. We'll get into that another day. So the next thing that I'll be doing kind of as my self-care, if you want to call it, but really preventative maintenance type things, is going back to my optician's office because I had a fitting for some contact lenses, and the close-up on it just wasn't working for me because I really do need to do some for work and reading. And so before I invested a lot of money into that prescription for the contact lenses, I wanted to get another try with the prescription that he wrote me for my eyes, because I used them and I was not very happy. And so I've been having to use my glasses more. On days I'm wearing my contact lenses, you'll see this sunglasses, and days I'm not wearing my contact lenses, you'll see my other sunglasses, because the other sunglasses, they're actually prescription. And the reason why I'm really big on wearing sunglasses is I am in my mid-50s. My grandmother had cataracts. I'm starting to get cataracts a little bit. And so my optician has advised me to maintain my eye health and make sure that I'm always wearing a good pair. Sorry, this was the side of my nose. Wearing a good pair of sunglasses when I'm out and about. So if I'm outside, I'm probably going to be in a pair of sunglasses because I'm protecting my eyes and making sure my eyes are healthy. So that's my appointment on Wednesday. On Thursday, I will be seeing my dentist, and I know a lot of people aren't fans of dentists, but I can let you know that there is a link between dental disease and cardiovascular disease, in the form especially of vegetation on the valve, which can cause a valvular disease. Yeah, we're trying to rush now because there's a storm. Oh, did I think you might have seen? You could have just seen lightning. So we're definitely not going to be waving metal here very longer. So yeah, Thursday I'm going to go follow up with my dentist. Just did a 6-month checkup, getting my teeth cleaned. I have had times where it's been necessitated that I see the dentist more. I have the need to always wear a night guard because I really like to grind my teeth at night. So anyway, I'm going to finish here because the weather's getting kind of crazy. There's a lot of people around. I think a lot of people are going to start coming up from the beach. But yeah, as I take my journey, so all of these things I just want to let you know before I finish up, because obviously this is where I always go. I've had to really cut this video up because obviously it's a holiday weekend and we're about to have a storm, and I always have to multitask between the dog and I, and my dog doesn't get into a car, so we're very limited on the places that we'll go and visit because of her inability to get inside of a vehicle. I can see a lot of this park, and this park is very popular because it just does. Because it's next to massive residential areas. Anyway, so yes, I'm going to see the dentist on Thursday. It's just a cleaning, and that's it. I have half the morning off. So yeah, I do have dental insurance through my work. Again, it's a privilege, but when I wasn't working, I did get some type of dental insurance through an organization. So there are ways to get. They're all terrible products. I'm just going to say they're all like really antiquated, and they really don't give you any type of great coverage anymore. Sorry, these sunglasses. I'm hot. It's because I'm sweating the roller down my face. They don't give you great coverage. They give you very limited amount. So I got the best I could get through my workplace. So that's kind of what I have. And I am very diligent about going every 6 months because I have had times where I have caused fractures in my teeth because I just have a habit of grinding them really badly. My health insurance, I got a PPO health insurance this year because I have a very interesting appointment next week, which we will go into later. But I always and yes, it sucks because I have to use my PTO to take time off of work in order to take care of my health appointments. Is that fun? No. Would I rather be, using the money to go on a vacation or buy some fancy clothes or put money away for retirement? Absolutely. But do I know that healthcare is extremely expensive in the United States, and you need to be very cautious how you spend your dollars and how you take care of your health and who you listen to your health information from? Definitely, because you can be really not taking care of your health and find yourself in some really tragic health circumstances. And I really do think that people should start seeing a primary care provider at least starting at 30. Start seeing somebody, try to build a relationship. I know it's hard. I know we don't get much time. I know it seems impersonal, but it's more that you start to get the preventative screenings that you need, that you have the blood work that you need at certain ages, and that you do have to. And I hope because you're actually watching my content, want to have an ability to make sure that you are getting the best care for yourself and making the best decisions for your health and making good and wise decisions because nobody wants to get sick. I can promise you. I work with people who are very young who've just had massive coronary events, and they're really quite surprised. They think that a lot of my patients, some of them who are young, especially some of the younger ones, I've had some people that have had heart attacks during half marathons, and they realize they really haven't ate very well. And that's probably caused them to have atherosclerotic cardiovascular disease and caused for the blockage of the coronary artery that then caused the cardiac event at the end of a half marathon. I mean, he tells everyone the story. I mean, I think he is just as shocked and surprised as, but sometimes I think people, even if you're exercising as much as you think you are, or being, sometimes, you may be, and supposedly all his lab work was good too, but he knew really that his diet was not as good as it could be, and over the years that diet will impact your coronary arteries. And so it is really important to make sure that you're eating a really good diet of healthy foods. Don't eat a lot of processed stuff, if any at all. Save that for a treat on occasion, but don't make it like a primary part of your diet, because it really does have really bad health implications. Okay. I didn't really structure this content. It's all over the place. My dog pulled me. There's a storm coming. I ran into a bunch of people. I got to go home and do some schoolwork. But I did just kind of want to talk about some of the things that I'm going to be doing to manage and take care of my health this week. And if some lady who's older looks really good and her jawline real snatched, it's probably because she's had some type of facelift. Just giving you heads up. And so, yeah, that type of work. And there's also a lot of privilege. Be cautious of these wellness places and these supplements. They can be very expensive and not necessarily beneficial for your health. Or if you are going to do something like that, so I'm playing with the sunglasses hugely. If you are going to do something like that, just make sure that you're talking to somebody who is a provider, because you could find that you're being misled. Been seeing, and you'll probably see some of my content down below, some influencers who died young, and one who may be dying young, who is very involved in medicine and wellness that's outside of traditional medicine. And in fact, she's getting very angry at traditional medicine. So I just, always want to give you a little bit of caution. Anyway, I have talked for too long. This is going to take me forever to put together. All right, I'll catch up with everybody tomorrow. My sunglasses are sliding down my face. My dog is yanking my arm. My arm is now officially burning. And so I just hope everyone stays well for today. I'm just going to keep trying to touch base. I hope everyone likes this type of content. Look down below, see if somebody has a medical provider that's licensed. Please help me get to 2,000 subscribers so I can get that notification down below to say that I am a licensed medical professional. Okay, don't be scared of us. We're great people. Okay, I hope everyone's taking care of themselves. Be good, be safe, and I'll see everyone later.